Centurion, this after National Healthcare Professionals Association, an organisation of medical practitioners, alleged they were being harassed, exploited and their claims withheld because of their race and ethnic background. Let's go to that briefing.
That you look deep on those lists that I've sent where they're no longer paying directly the healthcare practitioners and you act with immediate effect. As those healthcare practitioners, they are dying outside there with depression. Regarding Section 59, I'll just go straight that as a healthcare practitioner, as long as I've submitted the invoice of a claim, the claim must be paid to me, not to the patient, because that's the law of your Section 59 of the medical aid scheme, and not to the patient. And the investigation must happen within 30 days, as your section is saying that, and not counting back the monies from 3 years back. That's extortion. It must stop today. As I will close, I will say, according to the Health Professional Act Rule 22, no healthcare practitioner from today will be ever exploited by the medical aid. And I will advocate on behalf of the patient when it comes to designated service providers. That's affecting the patient outside there, because when they have to travel from one area to another area where you have chosen the doctor to see that patient, it's affecting the patient in their pockets, and also you are going wrongly according to the ethics law of supersession that you might not be aware of. That what you are doing, choosing for the patient, the healthcare practitioner, that's supersession, and you are doing it wrongly. The prescribed minimum benefit, I hope the committee will look deep into it and how it affects our patients out there. And the authorizations, when we are requesting the authorization before we admit patient, yes, there are patients maybe that you seem that they are not worth to be admitted, but those authorizations, look deep, because we cannot really, for a pneumonia patient, for an example, and want to know the x-rays, the bloods, before you admit the patient. That's a clinical diagnosis. So we are the doctors, we went to school for 7 years, we know what we are doing. Thank you.
Can I ask Ms. Musia to say something? Thank you. I'm Lerato Musia, representing from the Health Funders Association. And the Health Funders Association is an association representing schemes, administrators, and managed care organizations. Now, we acknowledge and are grateful to be in the room discussing this matter that the chairperson alluded to earlier on in his introduction. It is a crisis that we are facing on fraud, waste, and abuse as a country, one that has got dire consequences for everybody and eventually, obviously, for the country as a whole. But the one thing that we do need to do is to acknowledge that there should come a time when we all sit around a room like this and we discuss these matters to the fullest degree. And therefore, we're grateful to be part of this process. It is not only a process that has started now. We were invited by the CMS, which hosted the summit in early this year, around about towards the end of February, and we were part of the entire process looking at fraud, waste, and abuse, all in an effort to combat it. Now, it's a pity and very unfortunate that we've gotten to a point like this today, where it almost seems like it has really gotten out of hand. However, we are positive as HFA that the process that we've embarked on starting this year is going to be able to come out to bring out good outcomes to this situation. Now, in that process, there's a charter that was signed by all stakeholders. Most of the people in this room were invited to it, and we've sat down to form a working committee that is going to look at developing codes of good practice, and also including other bodies like the SIU, for example. Now, we're all committed to this process. We are saying that in the event that there is fraud, waste, and abuse that we know is happening. The investigating team that the registrar spoke to will tease out everything else that has to go with it. So the process that we've embarked on, that we are a part of and are collaborating with the CMS on, is that of forming that investigating team, and all the allegations that are going to come out of there are going to be handled by that team. We hope that it will be a process that will happen speedily. As you heard, it will kick off in the next week or so. And after that, the entire industry will be notified of what is going to happen. So far, all we're saying really is that the process has begun, and HFA is fully behind the CMS in this regard. Thanks.
Yeah, thank you for the opportunity. My name is Jose Letlape. I'm the chair of the Medical and Dental Board and the president of the Health Professions Council of South Africa. And one of our major concerns is that the working environment in South Africa, public and private, is not conducive to ethical behavior from healthcare practitioners. We've seen major changes to the Medical Schemes Act that are lawful, but a lot of them will not pass the mastery of ethics. I'll give you an example. The preferred provider system is an unethical system because it is not equitable, it has preferential treatment, it violates the rights of the patients for choice of a practitioner. So there are fundamental basic ethics that it violates. And we've always asked the funders, why don't you set the terms and conditions, and any practitioner that is prepared to meet those terms and conditions should be allowed to see patients under those terms and conditions. Originally, that is how the Medical Schemes Act operated. If you are prepared to be paid a REMS benefit, patients would be seen by yourselves and payment would be guaranteed. The second issue that promotes unethical behavior but is lawful is the fact that you provide services as a professional and you are not sure that you're going to be paid. And we're now in a situation where when a funder pays you, they have no obligation to pay you. They are doing you a favor. There's no law that compels them to pay you for services rendered. So they can withdraw payment and they can harass and intimidate practitioners as they do. The third issue that concerns us is the fact that when there are these allegations of fraud, there's unlawful behavior from certain participants because they talk about fraud sometimes amounting to millions and they do not report it to the commercial crimes unit as mandated by the laws of the country. So there have been laws that promote vigilantism against the profession. There are laws, there's lawful behavior that is promoting deprofessionalization. So practicing medicine is like an auction. What's your price? We won't take it from you. It's like you're at the market. And you find odd things where practitioners that charge less are outside DSPs. And practitioners that charge more are inside DSPs. You have challenges where it's the same service that is being rendered. It's the same standard that is expected from the profession. But through engineering, the funders are now prepared to pay a range of prices for the same service. And you can look at the demographics of the segment, the pricing segmentation, then you can then get into issues of them working along tribal lines and issues of discrimination that might be described as basically a racist act. Now, I hear from the CMS and I commend them for saying there are things that need to be done. But the position from the Health Professions Council is that what is unlawful should stop immediately. You do not wait for 4 months. What is unlawful should be stopped immediately. And what we will work with the CMS on in the 4 months is getting rid of practices that promote unethical conduct. We can't sit here and create a system of differential payment where a practitioner has to sit and look at a child that's sick, that can be treated on an outpatient basis, but there's no money to pay for outpatient treatment. And when you hospitalize for an illness that could be treated outpatient, are you behaving ethically or unethically? Because that's the only way that the plans have been written for you to provide care. We cannot allow that system to continue in this country. The serious deprofessionalization, the serious interference with the autonomy of professionals and the choice of patients. When you get told who to go and see, when medical aids begin to say to practitioners, if you do this type of service, we will not pay you. Remember, if you want this service, we direct you where to go. And they are now assuming the role of a regulator, the role of a professional body in deciding which practitioner can do what acts and which practitioner will not. And they use the money as the carrot. Lastly, the issue of racism is real. But the issue of racism arises from the patterns that have been created by amendment to the Medical Schemes Act. It is common knowledge that when you go to white practices, you pay up front and they give you your receipts and you can sort out your medical aid. When you are a member from vulnerable communities, the patients then say, I've got no money to pay. So you get seen within those terms. And it is precisely those practitioners that go out to help patients that come from socioeconomic backgrounds where they don't have credit cards to flush around or spare cash to pay for whatever else. Levies, being outside network, and all those fancy things that have been devised to promote unethical behavior and to erode the professions. The time has come when we need to stand up. There are amendments to the Medical Schemes Act, and I hope it won't be another 4 months of procrastination that stops those changes being effected. And I hope from the CMS's perspective, they understand the urgency of this matter. They understand the frustration that healthcare professionals face in this country. They understand the capture of the health budget by forces that are not performing any essential service in healthcare delivery. And I hope this will be a rapid process of coming up with the necessary reforms to ensure that professionals can be a part of this country and serve the community and be able to afford to act ethically.
Thank you. I'm Dr. Angelique Coetzee. I'm currently the chairperson of the South African Medical Association. I'm representing nearly 17,000 doctors here today. And SAMA welcomes this initiative of the Council of Medical Schemes. We think it's long overdue, and we think also that it is time to look at Regulation 759 to see how it can be amended, because it is outdated, and how it can be more relevant in the current situation that we are finding ourselves. SAMA will not comment on any racial or issues because we cannot prove it currently, but if it's proven, we will comment on that. We are fully committed to work with the Council of Medical Schemes, and we are pleading with the Council that the investigation team must be knowledgeable in this field and that the team should investigate without favor, without bias, in a total objective way, and that whatever the outcomes is, that the team will be bold enough to bring it out and to say, how are we going to address this? We also don't want this process to be longer than 4 months. And again, due to what happened this last few days, out of the darkness of what happened, we provide the lights from Council of Medical Schemes. So we try to change it over into a much positive thing, and the positiveness out of this is now we all need to do something. We cannot wait any longer, and for that again, I congratulate the Council of Medical Schemes.
Could I ask Dr. Gumede, and then we'll end with Dr. Clark.
I'm Dr. Ronald Gumede, the chairperson of the National Healthcare Professional Association. We are indeed honored to be amongst the Council for Medical Schemes, because this has been our cry about this Section 59 of the Medical Aid Scheme Act since our inception. Now, I would like to highlight a few things. We say no to vigilantism by anybody. It doesn't matter who you are, whether your pockets are deep, or whether you're black, or you're red, or you're white. We say no to it. And we also say yes to the rule of law. Everybody should be equal before the law. It should not depend on your socio-economic status or the color of your skin. And we condemn severely coercion and extortion of healthcare professionals by the schemes. You know, maybe I'm illiterate, but as far as I know, if you do a forensic investigation, if you're a forensic investigator, after you have gathered your information, you submit it to the relevant authority, which most of the time is the police. So, but what we have seen being practiced, it has been shocking and disregard of law. And we believe that this commission will be able to unearth these bad tendencies that have been happening. And we would like to request CMS to regulate because the medical aids, because that's their statutory obligation. They were established by law. They are a statutory body to regulate. Like the Health Council is a statutory body to regulate healthcare professionals. All we are asking, we are not asking fancy things, we're just saying, can you regulate your clients and make sure that they comply with the laws of the country? We're not asking for any favors or special effects. And having said that, we are not anti-progress. We want to be progressive. We want our patients to have quality lifestyle. What Dr. Tlape said actually it hits home, because what has actually mesmerized or destroyed the health industry in particular is these designated private healthcare providers. And that's what created problems, truth be told. Because the medical aids were able to manipulate healthcare practitioners. In the same area, they will come and choose you this year, and if you don't follow the instructions, they go to the next one. And that's horrible. You are playing with the lives of the patients here. Now, we are saying let people be free to go to ShopRite if they want to go and buy bread or Spar, anywhere where they want to go and get healthcare services. Let's not choose for them. We have a choice of services in South Africa, unless our constitution has changed. And then patients are punished in this tug of war most of the time. And I hear most of the time medical aids saying they are protecting the interests of the patient. We will see probably when the commission is finished. Where does this money that they take from the patient and the money that they take from the healthcare professional go to. That's the core thing that I would be very happy if it can unearth that, because we need to know where does these billions that are declared, like 25 billion, whatever, where does it go of waste, fraud and management and all that. We'll be happy to know. Lastly, I would be very pleased if the Council for Medical Scheme make a declaration to their members, because our members in general, they still received letters up to today, up to this morning, requesting files by the schemes and clinical notes. As of today, not yesterday. So please, you must come out clear and mandate your constituency to desist from breaking the law. I thank you.
Thank you, Chair. Thank you to CMS Chairman and the Registrar for affording us this opportunity to sit in the same room and talk about the crisis that is facing us. I'm Dr. Hleli Nhlapo. I represent the Board of Healthcare Funders and the Health Forensic Management Unit. I must say it up front that the constituency of BHF, I don't know of anyone that uses race to discriminate against claims, because what we use in the industry is the PCNS number. One has to be a registered, a qualified person, gets his number from the HPCSA and then get a practice number, a registration number from HPCSA and then a practice number from BHF or PCNS, so that he can be able to submit claims. And that particular number has got no race, has got no black, yellow, red. So I really don't understand this notion of race. I don't want to say things that I'm not sure of, but I'm definitely sure of the practice number has got no race in it. I'm still waiting to see the results of the commission that will prove to me that race is the real issue here. So as far as I'm concerned and all my constituency, the race issue, I don't know where it comes from. I must commend you guys for having started this initiative. We fully support it and we're going to give our all. We're tired, from the funding side of things, of us and them. Some of us are colleagues. We went to medical schools. We qualified doctors ourselves. We know what an ethical practice is all about. So I'm really looking forward, with all my constituency, I'm looking forward to seeing this process going to its final conclusion. We give it, we support it, we give it our all, and we will run with it from the beginning, Dr. Kavan, to the end. And the truth will prevail. But as for now, we've got the law. The law still is there. Section 59 is there. And I think the medical schemes and the funders will continue using it until such time that it is outlawed. For now, it's the only law that we are able to settle and reject claims based on that law. So we will allow the process of going through the whole system and looking at all the issues that have been addressed. And once all is said and done, and maybe one day, Dr. Kabane, the law gets changed, we'll abide by it. We are as much as civil and law-abiding citizens of the country, having the interest of the patients at heart as well, which are our members, and we'll continue doing that together with you, with the service providers, in the room and outside of the room. Where we've erred, when it comes, when the results of this investigation are done, will be man enough to change our ways, if at all. Thank you.
Thank you very much. I'm just going to open up, before we take Dr. Clark, let's open up to journalists as agreed on the format. Questions from the journalists, and if there are any follow-ups from the panel, we'll probably allow, if time permits. So I'm just going to allow if there are any questions from the journalists. Please identify yourself with your full name and surname and the institution that you represent. Any questions? Yes.
Good afternoon, it's Patricia Masaki from the SABC. What I'd like to seek clarity on in this question is perhaps directed to Dr. Neely as you are leading the panel. If you can maybe give us an indication how long ago or as how far back have some of the complaints, some of the allegations of some of these malpractices being reported, because it seems like it's been going on for years, and only now action is being taken. We have read with great disturbance of some of the doctors who had to close their practices, who have suffered greatly, their families being affected, and in a constitutional democracy to still hear such is really disturbing. So how long has this been happening? Have you been aware of this, and why are you only acting now?
Yeah, thank you for the question. Anecdotally, we have known for some time about some of the complaints, but because the entities that we regulate are the medical schemes, the administrators, managed care organizations, and brokers. So complaints about doctors tended to be sent to the Health Professions Council, about brokers to their various bodies, FSB and so forth. But on our side, we were accepting complaints about schemes specifically. Anything that affected the schemes, we have a unit here that deals with complaints. We've attended to the complaints that were directed at us, and we've got a record now where Dr. Kabana will know for the period, for how long we've been entertaining some of the complaints. Just to reiterate that there have been, it's only those that affected schemes that came to us, but those that included doctors and other entities tended to be sent to their various regulating bodies. Dr. Kabana, can you add the period?
Yeah, Chairperson, without specifying the period, I think if we assume that the Act itself, as promulgated in 1998, has actually been enforced, and yes, there have been complaints, there have been allegations that have been addressed to the Council for Medical Schemes, and from where I am seated, these have been dealt with, but obviously, what we have had in the past week or so is a picture that is much more disturbing. This is the first time that we've had that there's a blacklist that's circulating that says members of the public should not access services from specific doctors. It's also the first time that it has come to our notice that schemes actually keep a list where they block payments for specific service providers. And we couldn't, when we hear these serious allegations and misconduct, as a regulator, keep quiet. That's why we've been out there trying to say to people, we need to redirect all of these complaints and allegations back to the CMS so that they can be analyzed, so that they can be, investigated, and specific recommendations made. Having said that, one of the things that CMS does here in its regulatory activities is actually to do routine inspections. And these are directed at schemes, at administrators. And when we have had complaints or tip-offs of schemes or these administrators not conducting themselves appropriately, during those inspections, we also focus on some of these. There are inspections already that have been done in some of the entities that we regulate. Some we have released the results where we have instructed them to change some of the findings based on what we have picked up. Some are in the tail end. I think people that were there when we released our annual report would have gotten a sense of schemes that were under our investigations, where we've done inspections, and we're in the process of implementing those. But the reason really that has made us to run faster is really the seriousness of the allegations that have been put there. We're also aware that there are several of these complaints that have gone through the CMS process and are currently being ventilated in our court systems as we speak here. So it isn't as if we've just woken up to this here. It's just the severity and the seriousness of this that has caught our attention, particularly the blacklist and this racial profiling, which we now want to really focus on and ensure that it gets done.
Just another question. I picked up that most of you are saying that this must be done as speedily as possible to obviously get to the bottom of this. I hear that there's already an indication of 4 months that is being called for. So is 4 months enough to actually delve into a matter this complex and that has been happening for this long? Is 4 months sufficient? That's the other. The other question is the health practitioners who still have outstanding funds. Will there be any provisions made to perhaps pay them, for now, release the funds that are due to them? Are you going to make provisions for that while the probe is pending? How will you be tackling that particular issue? As you know, people are suffering, they're waiting for that money, their lives are dependent on that. So how are you planning to deal with that while you tackle the other issue here?
I'm going to ask Dr. Gawanini to take that one, particularly the process.
Yeah, thank you. We could have said 1 week here, but given the enormity of the task and the urgency, we've given ourselves 4 months. And basically, we have narrowed the scope here of the investigations, not to look at all the ills that sit in the regulation of the Medical Schemes Act and its regulations, but we're focusing on Section 59 and Regulation 5 and 6, because these are the areas where disputes around claims, their processing, the payments, the investigations, the conduct of various parties around that. And we are hoping that if we zoom in on that and we're able to correct all the contentious issues, the ambiguities that sit in the Act, and if we're able to make the necessary changes, then it gets rid of the problem, not just for the immediate, but for the medium to long term. You'd be aware that there's a bill that is in process. So we're hoping that some of these recommendations find their way into the bill so that when it gets promulgated, it already contains all of these changes that we are proposing. But can I just also indicate that Section 59 and Regulation 5 and 6 are just one part of a huge act here, out of which there are many complaints, many disputes here. So it isn't as if the business of the Council for Medical Scheme is just centered around that here. So what I've heard from the stakeholders is that over and above what sits in Section 59 and Regulation 5 and 6. There are other areas that people would want to revisit. The DSPs, for instance, that sits in Section 8, the prescribed minimum benefits, etc. So we've taken all those issues that stakeholders have got issues with, and we've parked them. We want to address this as an immediate problem. Once we've comprehensively dealt with it, we believe that we can address other issues. I've already indicated that the investigation itself is being prioritized. We're going to get the most competent people to do the work. So we believe with a narrowed scope, a competent team, and if they are given space and cooperation, within 3 months there should be a preliminary report here. As you say, people are waiting for the outcomes of this here.
Dr. Iklamba, if I may get maybe a reaction from you. Even within probes, we tend to see elements of, fraud and corruption also playing in there, where things get manipulated. What should be done with this particular probe to ensure its credibility and integrity? That's the one, so that we can really get a just outcome here, so justice can be served fairly and the Constitution can be respected. That's the one. The other is those who have broken the law, who have brought us here today. What's the action that you would hope, that you would like to see taken against them?
Well, just as background, I've been with the HPCSA for 8 years. And in the 5 years prior to the last 3 years, I was chair of a prelim committee. And these issues came up in that period. And we as the HPCSA have written to Council on the issues of the behavior of their members, for which we have no authority over. So this matter has been a long-standing problem, but it's not like it has not been reported before. So what you have now is like everything, for some reason, it looks like the media is always needed for any crisis to be resolved in this country. It is now in the media, and that there seems to be some agency, and we thank you for doing your work so that the patients and the practitioners can get some relief. Now, in terms of what we expect, what we have made clear is that any practitioners that act fraudulently need to be reported to Council. But all those that investigate those issues need to respect the laws of the country, because that will empower us. Because if there's fraud, there will be criminal charges that should also be laid if this fraud exceeds 100,000 rands. It would then enable us to be able to take out practitioners that may need to be taken out. But in practice, what happens is that because it's a poison fruit, because it was not obtained lawfully, it limits us in terms of what we do. And in some instances, you find that when the action is being taken, there's been a kangaroo court of sorts, and there have been agreements that have been made outside the courts of the country, where there's an agreement between the practitioner and the fund, and it's business as usual, which makes it difficult. That's why we're saying the laws of the country need to be respected and things need to happen. But having spoken about practitioners that are fraudulent, we also need to talk about the authorities that are acting unlawfully, and they also need to be dealt with, because it is an abuse of power. Now, to hear when people say, there's a BHF number, there's no issues of race, when they go into practices, they profile you. Okay? And maybe they may explain the criteria for profiling. And once they've give you their numbers of profiling, you can do the tribal distribution and see whether it fits the demographics of the country. And you can then make up your mind. I mean, in the US, there are no specific laws that says the cops must shoot black men. But it's known that one of the threats to life is driving whilst black. So it would be unhelpful when people do not commit to looking at why something that is not racially motivated comes up with a racial skew. And we hope that those matters will be interrogated. And I repeat the fact that the way we operate, you see, one of the fundamental issues that nobody talks about is that previously, care was guaranteed to members and payment was guaranteed to practitioners. And that has been done away with. And when medical aids pay you now, they're doing you a favor. There's no law that compels them to pay you. So they can give your hard-earned money to a patient. And that's lawful today. And that's the position that we find ourselves in. So there are certain things that need to be done with extreme urgency that don't require you to wait forever. Just a simple switch from saying you will always pay the provider. And unless you have good reason and you can take it to court, pay the people what is due to them. That will answer your question about what's going to happen with the monies that are being withheld. If they are being withheld without reason, if they are being withheld unlawfully, if we respect the Constitution and the laws of the country, those monies must be released with immediate effect. They do not have to wait for a quarantine period of 4 months. We're losing practitioners. The rate of suicide among practitioners is going high. The rate of ill health amongst practitioners is quite high. So we can no longer stay indifferent as a regulator when we are expected to regulate in an environment that is not conducive to ethical behavior. And that cannot be treated on a time period. It has to be dealt with as an urgent matter to be dealt with. There are changes that are muted. So what I hope would be coming from CMS is that all those changes that the minister has looked at over a prolonged period of time that would have been promulgated and the elections came into a problem. As we do this, they should expedite amending those things that need to be amended. We should not do this business of saying, hold on with the amendments until this probe, because it's been a holding pattern while the nation suffers.
Thanks, Doc. I think I'm going to allow then also from the funders, Nedara Thomas here, just to respond also.
Thank you very much, Karen. Dr. Letlape, we hear you fully. However, I'd also like to say that exactly what you're saying, that there is racism, we need to go through a process of ascertaining and making sure that we handle this matter as professionally and as with much fact as we can. So going back to what my colleague said, Dr. Nklapo, on the side, when he spoke about it being an administrative process, there's administrative processes that go on when it comes to claiming. There's also contracts between the providers and the funders as well in this regard. So what we would like to say as HFA, and I'd like to reiterate this and really put it on record, that we condemn all forms of racism and that it shall not be that we sit and we say it could be happening, it could not. But the processes that are in place.
All right, and so we're going to come out of that briefing. We conclude the show for On Point. SA Today coming up at the top of the hour. Do take care and stay tuned.